Hello, colleagues. Greeting IAM mentors. I'm very pleased today to introduce Kate Zeigners with Certified Nurse Midwifery to tell us a little bit more about the process of applying. So thank you, Kate.
Yeah, thanks, Melissa.
I just wanted to start with, just since a lot of our listeners are most familiar with the medical school application process, just like a general overview of the role of a midwife in prenatal care and delivery.
Yeah, absolutely. Yeah, most people think about pregnancy and delivery when they think about a midwife, and we certainly do that. And I would say that's kind of the bread of butter of most of us midwives. We see patients throughout their pregnancy. We meet them at that first visit and are able to do a bedside ultrasound to confirm the pregnancy. We see them throughout their prenatal care and are able to offer them everything they really need for kind of normal, low risk pregnancies. And then we meet them when they're in labor and we're able to guide them through their labor, deliver their baby. And then we also do their postpartum care. So we're able to guide them through that entire journey. But at Kaiser, we do a lot more than just pregnancy and delivery, too.
Yeah, can you maybe describe some of the other clinical duties that you get to participate in?
Yeah, absolutely. We do a lot of preventative care. So we do a lot of pap smears, breast exams, people coming to see us for general women's health. We do a lot of those visits. We also do a lot of visits around contraception. We do a lot of counseling on birth control options, helping people decide what's the best option for them. And then we do a lot of management of birth control. Say a pill is not working well and the patient's having some abnormal bleeding that they want a little bit more management of. We're able to tweak that and figure out a new method for them. We do a lot of procedures around birth control as well, insertion and removal of IUDs and implants. And then we also do a lot of education, screening, and treatment of sexually transmitted diseases and basic women's health gynecologic things like vaginitis. And we also can do menopause management. And at Kaiser, we do pregnancy terminations. So we're able to help patients make those decisions. A lot of our time is spent on counseling around those decisions and deciding if the patient does not want to continue a pregnancy, what the best route is, whether that is continuing the pregnancy and doing adoption or terminating the pregnancy. And then we're able to manage that process for them and help them through that process. So we're able to really meet patients at kind of all points of their reproductive life and afterwards for menopause.
Yeah, it sounds like you get to follow them longitudinally as well.
Yeah.
And how does being a certified nurse midwife contrast with a licensed midwife?
Yeah, that's a good question. So certified nurse midwives, all of us at Kaiser are certified nurse midwives. And that means that we started off as registered nurses. Some of us worked as registered nurses for many years. Others came into this field kind of mid-career, but went through the education to become a registered nurse before then getting additional education to become an advanced practice nurse practitioner. And then within that nurse practitioner license, we have a certification of nurse midwifery. A nurse midwife has the broadest scope of practice in that we're able to do a lot of primary care because we have that basic foundation in nursing in general. And as a part of our education, we are exposed to other fields like medical surgical nursing, pediatric nursing, things like that. A licensed midwife goes through an education process that is a little bit more focused on pregnancy and birth. And licensed midwives generally deliver babies, offer prenatal care and deliver babies outside of hospitals, in birth centers and at home. Certified nurse midwives can also do that, but certified nurse midwives are the type of provider that are able to make that bridge over to the hospital and provide services in the hospital setting as well as outside of the hospital setting.
Good, thank you. And how would you suggest that our students get some exposure to the midwifery field?
Yeah, that is a hard one. it's a tough thing to do. But I think, just thinking about myself, I came into this career a little bit as an adult when I was already in a different career, and I wanted some exposure to birth here in the US before I made that decision. And what I found to work for me was working with a doula,
Mm,
and becoming a doula myself. So, a doula is a labor support companion. It's not a clinician, not a medical provider, but somebody who is able to work with a pregnant person and just be a support emotionally and mentally, and then be at their labor to advocate for them and offer them comfort, everything from a massage to I will get you some tea, things like that.
mhm,
And I found that it was difficult to shadow actual midwives because oftentimes they have student midwives working with them. But I was able to shadow doulas, and then I was able
mhm.
to become a doula myself so that I could attend births and kind of see how midwives, as well as OB obstetrician physicians, interact with birth in the US hospital system. So I think finding a doula or becoming a doula is a good thing to do. Reaching out to local midwives in your area, both nurse midwives as well as licensed midwives. They might be able to take you on as a shadow for a shift or two, for a birth or two, of course, with the patient's permission. Um, or or just kind of reaching out to friends and family that might be pregnant, and asking if you could be involved in their pregnancy, and what level of comfort they would have with
Mhm.
that, with you being at their birth. Because even if their birth is not attended by a midwife, it's still, I think, exposure to birth in the US and exposure to pregnancy care in the US is as much important to getting into this field as working with an actual midwife.
Yeah, thanks. Those are all really great suggestions. And then you started to mention this a little about sort of like traditional and non-traditional paths
Mhm.
to get to be a midwife. Could you just sort of maybe briefly talk about those?
Yeah, absolutely. So I'll focus more on the certified nurse midwife role. I think the vast majority of people that become nurse midwives were nurses originally. So went to college, studied nursing in college, got their bachelor's of science in nursing, and worked as a registered nurse for a number of years, and then decided that they wanted to become a nurse midwife. And so those people would go into a program, either a master's level program or a doctorate level program, to get those additional clinical skills and leadership skills in midwifery, and would then leave that program with a master's of science in nursing, um, and or a doctorate of nursing practice, and be able to sit for the boards to take their or I'm sorry, to get their nurse practitioner license and their certified nurse midwife certificate. However, if you did not go to school to become a nurse, like me, if you went to college for something completely different, and then years later decided that you wanted to make a career shift and go into nurse midwifery, there are programs for people like that as well. And what that looks like is you do need to take a number of prerequisites. And this is similar to a pre med program. So basic classes like biology, physiology, anatomy,
Mm.
statistics, nutrition, would all have to be completed before you start this non-traditional program. And there are many ways that you could do that. You could sign up for a pre-nursing school year at your local university, and just knock all those classes out at once. Or you could do something more like what I did and take them a la carte, through a community college system or any university, and just sign up for the individual classes while you are working at whatever job you're at or doing whatever else you are in life. Once you've completed those prerequisites, you can then apply for and start one of these non traditional programs. Those non traditional programs are very accelerated and very packed in. So, what
Mhm.
they usually consist of is a full year or year and a half, including those summers of basic nursing education, so that you leave at the end of that. You don't actually get a bachelor's of science in nursing, but you get that education, and you would sit for the NCLEX, which is the board exam to become a registered nurse. Once you've passed that, you would move immediately into that master's or doctorate of nursing practice program that colleagues who maybe already were registered nurses would then also filter into. Um, and it depends on what school you go to. But usually, if you do one of the non-traditional accelerated programs, it's about a year and a half of that basic nursing before you would move into an additional 1 to 2 years, depending on if it's a doctorate level program or a master's only level program of the advanced training. So roughly 3.5 years. And then if you think about the prerequisites, and they're substantial.
Mm,
So, 4.5 years of school, basically.
okay,
Yeah.
thanks. And besides the school requirements, are there other requirements that specific programs have to be able to apply?
Yeah, some of them require a certain number of volunteer hours.
Okay.
Sometimes that can be whatever you want, and just evidence that you are involved in your community and kind of active outside of just your whatever job you're doing or whatever school program you're in at the time. And other programs do have more specific volunteer requirements that, it has to be clinical volunteering. You have to be, a health scholar at a university or something, or I mean, at a hospital or something like that. Um, so the prerequisites and some community volunteering. Oftentimes, schools will ask for scores of basic college level exams like the SAT or the ACT.
Mhm.
So maybe if you didn't take that exam for whatever reason, you might have to. But most of the time, they will just look at those exams, or maybe look at your college transcripts if you're coming in to one of these more non-traditional programs.
Okay.
Um, yeah.
And then how did you learn about some of the programs to apply to, or are there resources where people can learn
Yeah.
about midwife schools?
Yeah. So, I kind of just living in Seattle and being in the general field of midwifery. I was in the field of public health before becoming a midwife myself, but I was working specifically on midwifery public health. I kind of had exposure to the couple schools that were here in the Puget Sound area, and that is the University of Washington, of course, Seattle University, and then there's a couple down in Portland. Oregon Health Science University is a big one. But there is a website, our professional organization called the American College of Nurse Midwives, or ACNM. If you go to their website, which is www.midwife.org, it's a nice, easy website to remember. They have an area where, if you are looking to become a midwife, you can go onto that website, and there's a whole list of schools. There are 39 accredited midwifery schools in the US. I think all of them are, your traditional in-person education outside of two, and I might be wrong on that, but I'm pretty sure I'm right. But there are two very, very established and well-known virtual programs for midwifery. Georgetown University, which is the Georgetown University that is in DC, and then also Frontier University. So those schools are where you do all your didactic teaching online
Mhm.
with a cohort, and then you'd meet a certain number of times each year in person with that cohort. But then you have your clinical rotation, where in whatever city you're living,
Mm,
and then your clinical preceptor would coordinate with your didactic faculty at the school to make sure that you're getting what you need.
great, thank you.
Yeah.
And then I guess just to close, is there any other advice or sort of closing thoughts that you'd want to convey to our mentors as they're working with all of our URM students?
Yeah. I think midwifery is just such a cool field, because I think it offers us the opportunity to do so many things and to really be present for people during a really, really joyful time in their life, and sometimes for a really sad time in their life. We do die, we find a lot of non-viable pregnancies, miscarriages, essentially, in the early part of pregnancy. We do those terminations. So there are definitely moments where we're helping people
Mm,
work through sad feelings around pregnancy or anxious feelings around pregnancy, but there's a lot of joy too. And it's just really, really fun to be able to work directly with families as they move through these periods. and then offer like, trauma informed, really good care for outside of pregnancy too, and help somebody get their first pap, and they're really scared, and you
Mhm.
talk through it with them, and then they are like, wow, that wasn't as bad as I thought afterwards. That just feels really good. um, but on the other hand, I would make sure that people who are kind of making this leap and putting in the time, the money, and the effort to do this also recognize the hard things that come with it. There are scary moments where emergencies happen, and you kind of need to be on your game and ready to manage it, and reach out to others that might help you manage it. And then also just recognizing that the hours are sometimes rough. Babies are often born in the wee hours of the morning, and so it's a lot of nights and sometimes holidays and weekends. Um, can be hard on your body, and so it's important to keep good self-care, and be in a practice where you feel
Mhm.
really supported by your other partners.
Mhm. Well,
Yeah,
thank you so much. I feel like that was a lot of great information. It'll be really informative about a really rewarding field for both our
yeah,
mentors and mentees to be able to
yeah,
discuss. So thanks so much.
yeah. Thank you.